It's on now. So welcome, everybody.
Thank you very much, and thank you for the invitation. And I will share about the work we have done on edible insects dinner products and how it impacts on meat intake in Danish families. So what we were asking was whether insect food products could be a part of regular dinner meals as the pathway to reduce meat consumption. And we set the target of if we could actually replace 20% of the weekly meat protein with insect protein. So how did we do that? Well, we developed criteria for how these insect dinner products should actually what should they be like? What should be the quality criteria? And then we developed and experimental batch produced 6 dinner products which could fit into what we call a food basket for a menu. And we provided this for families with children in Copenhagen. We did a parallel study also in Portugal, but today I will talk about our family with children study we did in Copenhagen. We also looked into the sensory quality of this product, and then we compiled about what was the lesson learned. It was all conducted as a part. It was conducted as a part of the Sausage Chain project funded by the EU. We also have a PhD student, Cassandra Meyer, as a part of the team on additional funding. And then you can see here the partners all contributing to developing the food products and also do the sensory and consumer tests. So some of the background for how we designed our study is that, what are the barriers for getting edible insects into our regular diets, into the food? And we know from the scientific literature that the acceptance could be improved by if we can have repeated exposure. I mean, go beyond one time, like, do you want to taste this insect? Did you like it? To actually to have exposure over time. Also that it's exposed in an familiar and accessible environment, meaning what we did was to bring it all the way home to the families, not in a like excited event. And we also know that neophobia, are we reluctant to test new foods, is a barrier. And we know that how can we actually get these insects into the family foods. Disgust is a major barrier. Can you see these creatures in your food? And then one aspect we also have been very interested in is that, well, we are looking into reducing meat consumption, because that's the pathway actually to make the diet more sustainable. But we actually have a meat attachment. It's not, we can differ in the way that we feel about having meat in our diet. So what we did to overcome these barriers, we would like to expose these families over a longer time. We also wanted to understand what is special about insects by comparing with also introducing a new menu to the families, but plant-based, which will be less new. We purposely didn't present the insects as whole insects, but without being visible to bypass the disgust. And we also addressed the no phobia and the meat attachment. So what we did? Well, the first activity was actually to decide how should these insect dinner products look like, what should it be. So we gathered all the project partners with 6 of them, each being responsible for developing one product. And one of the criteria that we settled was there should be a minimum amount of insect protein in a serving to consider it as a dinner product. We should be very careful about the sensory quality of the product. And what the starting point was that we had a very early prototype of different products, and that was the starting point to developing the 6 products that went into these food baskets going out to the families. So the protein content, how much protein, insect protein, should be in these dinner products. So what we did was, we were developing the product for the family trial in Denmark, but also for a trial in Portugal. We looked into the national data we have on meat consumption, and then we made a estimation saying, well, this average meat consumption, if we distribute that on meals throughout the week, if we could replace 100% of the meat, no meat, insect protein in the same amount 3 times per week, then we would reach a replacement of 20%. So that was our assumption we had to set a target for how much insect protein. And you can see for the Danish adults, we ended up that we need to have around 13 grams of protein in a dinner serving to reach this target. So why this focus on protein? I think it's important also for developing what are the kind of products to reach out to the consumers, which should be to what is the motivation. And the climate awareness is really driving the consumers, and this is where the meat, the dairy is what is of concern, and they are also the protein sources in our main meals. So we are looking for these alternative protein sources because that's the pathway to be more sustainable through reduction of the meat consumption. So this is where insect fits into being this to be a protein replacement, and we need to make it a replacement of meat, really not to add more protein into our diet. We eat more than sufficient protein, but to replace the meat that's already in the diet. We also set with our first step and with gathering the partners involved to define that we need to have products with good sensory quality. So they should be appealing in taste and texture. Texture is actually a big thing when it comes to acceptability and liking for the consumers. Whether there are traces of insects, whether you get pieces into your mouth, and whether it's completely masked. And then also the taste is something that the innovators have worked intensively on to get this insect umami without having an overwhelming umami taste and really get a good balance. So with the very first gathering, when we got together in a workshop in 2020, we each of the producers or the innovators brought this prototype, and we exposed it to a sensory panel, which got trained for this purpose. And here is just some examples of what the exposure to this panel, what was the feedback or the evaluation, and like for the taste and odor, the smell, that it was like stable, like it was like being in a cow stable. It has different, not very appealing feedback also for the appearance and texture. So there was plenty to do to improve before we brought it out to the families. So we continue to do also sensory quality in consumer panel with Sensitest, the Portuguese partner in the project. And when we had improved versions of the product, it was tested in a consumer panel. And here we see an example here on how the different products was evaluated. And the further down, the less liked it was. And we can say already here that we were really challenged by the sausage product all the way through. But this was a dynamic and ongoing process for a year or so. So the final products that we decided was ready to go to the family trials is here. It was a falafel. We called it a falafel, like a meatball product. And it was a crisp bread. It turns out to be a crisp bread. It started out as a bun, but in the end we had a crisp bread. It was a mince, like a mincemeat product for going into different standard dishes. It was a chili tomato paste, and then a sausage, and then a spice mix, which could also be used for different composite dishes where the insects were incorporated into this mixture. So this is how it looks like when we had batched produced the products for the family trial. We had 5 products which was stored frozen and distributed to the families. We had the crisp bread, which was kept cool but not frozen, and they were packed in portions which were suitable for the trial, and they came as what we call the food basket. So you could make a variation of 3 dinner meals per week over a 6-week period. So for the sausage chain project, we had these 2 intervention trials, the one in Copenhagen, which was conducted by us in our department, and then we had a parallel study also in Portugal. And at each site we had 80 families. In our case, where 1 adult and 1 child in the age of 8 to 10 years was enrolled as participant in the study, and then they were receiving either the insect menu with the product we developed, or we made a plant menu by by actually getting similar products from commercial suppliers to match the products that we have developed. So the overall aim was to investigate how exposing these families to these dinner menus with the 2 different protein sources would impact on their dietary pattern, on their intake on meat, also their total protein intake, and this was all for each participating families was in the study for 6 weeks. So we were recruiting the families through electronic invitations, which we were able in Denmark to send out by getting contact information from the civil registration. And we recruited for families which should be overall healthy, and also that they were not on any special dietary preferences before they started. So they should eat meat. We asked them, are you regularly eating meat, and at least 5 days per week? And also, of course, if they were willing to consume either insects or plant-based foods. And we also made sure to ask about allergies, and also that we didn't want them to be on any specific restricted diet. So what they were provided was the insect food basket, as with the products that we had developed and batch produced, all the plant food alternatives. And we also, for each of either the insect products or the plant products, we had developed and tested different recipes and made a recipe booklet with pictures and serving suggestions for servings, which were all like going something which was familiar, and how many families in Denmark would have their dinner meals anyway. So it was really the purpose to make it familiar and kind of lower the barrier of actually knowing what I'm going to do with these products. So for the study, well, we had to do the recruitment, and then we did some what we call baseline measures. We did dietary registration. We provided with a number of questionnaires for neophobia, disgust, meat attachment, and then when they have given their consent, also on behalf of the child to be part of the study, they were randomized to either receive the plant or the insect menu. And then for the next 6 weeks, they would come back every second week. So we had them in here for another 4 times. And they would do a number of online-based questionnaires, like they did daily records of meat, of their meat consumption, of their experimental food consumption, and some other questionnaires. So in the end, we were sending out almost 7,000 invitation letters through this electronic system, where we were able to, by zip code, we can identify on this address, we have 2 custody holders of a child born in this to be this age. So there were all invitation letters going to relevant families, and out of this we had information meeting with the 91 families, and in the end we had the consent given by 80 families, and they were randomized. And then in the end, after the 6 weeks, we had 57 of the 80 families to complete, and we could see that there was we had more families decided not to complete the 6 weeks in the insects group compared to the plant groups, which was also expected. That's why we had the plant group, is to say, how does insects, what is special about insects compared to other alternative proteins. If we look at the protein intake over time, over this 6 weeks intervention, which was one of our main interests. Well, this is a pretty busy slide, but for the total protein, either in the insect menu or the plant menu, we didn't see any change. We saw the same total average protein intake in the adults and also for the children, which means that this intervention didn't in that way change their overall diet. But we saw for the adults here, we saw a significant decrease in their meat consumption in both group, and it was slightly greater in the plant menu than in the insect menu. We saw that this what we will define as the meat replacement is that how much was the meat protein intake reduced and replaced by the experiments, by the products that we provided. And we could see that we set the target of 20%, which was ambitious. We knew that. We found a higher replacement in the plant-based, and for the insect menu, we found a replacement of around 5% and about the doubled in the plant-based. So what we saw while we are talking about novel, really a very unfamiliar product from the insects, and we were, you can say, still able to reach to introduce it into the families and actually have an impact on their meat consumption. Another way to consider the meat replacement was not to go by protein intake, but to go by number of meat meals. So every day the participants would receive a link to a small questionnaire asking them, did you eat meat today? Can you estimate what was your what was the portion size? Was it less or more than you would usually eat? And the same thing for the whether they would have consumed the intervention meals. So roughly here, what you see was that, well, we provided for the insect, for each of the menus, what would be three dinner meals per week. And we saw for the in the insect group that they on average would consume 2 of the insect meals per week. So they skipped some of them. A little bit more in the plant menu, but still not reaching all what we provided. And they kept also the meat meals in their menu. So we did see a reduction in number of meals, but it wasn't completely matched with the number of introduced meals. So it's kind of, you can see maybe the meat meals was kind of maybe moved around in the weekly dietary pattern. The intervention was able to reduce the number of weekly meat meals, but it was what we also saw for the insect menu was that they on average actually only consumed half of the portions that was provided, which was the portion was set to reach this protein intake that we had defined upfront in terms of being able to replace what would be considered a normal dinner meal. This is kind of a busy table here, and it's presented here it's more of this in our publication. It's just to give you a little bit of insight into how which factors actually affected the protein intake. And we saw, if you highlight here with the p-values, it's in some linear models, which is adjusted for different things, but we could see that women would eat less total protein. Also, if we adjust for their body weight, they also eat less meat protein than men. We also didn't see a difference between the two groups. And then for these different factors that could that is the barrier or can affect our protein and meat intakes in many ways, we actually saw that the meat attachment was the only psychosocial variable that had an effect, and it had an effect. The more meat attachment, the higher higher was your meat intake, the more difficult it was to replace your meat with your alternative proteins. A little bit on the sensory quality. We did quite some testing of the different products with at this sensory lab in Portugal. Here are the results from the families in Copenhagen, where each of them would evaluate not all the 6 products, because that can be too burdening, and then you tire your participant, but each were randomized to evaluate 2 of the products. And what you can see here is the green one is when that was the first time, their first exposure, and the blue one was the last exposure. And we have this, there is it could be that you get used to this new product, so you would like them better or you like them less. Well, we can see that for the adult and the children, there was some differences in the preferences. The children didn't like the new products, the spice mix, so much. And they really liked what we call the mince meat. And that's because that was also prepared in the family for family meals, like for a spaghetti sauce or something. So that was, that's what you see over here. It's very well liked. And then we had a consistent challenge about the sausage products throughout in the development process, and also in the exposure to the families. That it was a very difficult, and it was the same thing for the plant-based sausage, which we got from a commercial supplier. It was also not very well liked. So what does this point at? Is there a way forward that we get insects on the family dinner tables in Europe? Well, here from our study, we can say, well, we were able to get families with no experience in insect dinner products, and actually 22 of these families, they consumed and a number of them were really happy about the products for the 6 weeks. We invited through our civil registration system, where we could actually reach out to all families meeting the criteria, but those who responded and actually agreed to participate were all very highly motivated for changing to sustainable diets. We also had highly educated participants, and with quite a lot of social resources. And we also saw how the quality of the products really matters, and that was for the plant products and also for the insects, that the quality, the sensory, the culinary quality was really important. I think it's important in this to get insect into the family dinners to stick to the focus that it is about this meat replacement, because that is the way. That's a pathway for a more sustainable diet. And insects really have over the plant-based and other sources that they have this, which can be turned into be really attractive, this animal umami quality, which can be challenging in the meatless diets. So what can be done? Setting quality standards, including defining if you put a product on the market which is declared as something which should go into dinner products, there should be some declaration of how much of these alternative proteins should actually be in this product to be considered something that will be a meat replacement. It's also a consideration that the product you should know the dietary culture and patterns of your consumer groups to see how does this product fit into their ordinary their diets and their food culture. And of course, legislation has been on the agenda for a long time, and we also could see from the research and from our participants that health and nutrition benefits was really something they were really interested in. They really wanted to know more about, is there anything special health and nutritional benefits of insects compared to meat? So it's really important to understand the food culture, dietary habits. How does it, if you put this product on the market and just leave it with the consumer to say, well, what I'm going to do with these mealworms or this cricket powder, then you are not helping to overcome this barrier and actually be a regular consumer of the new products. And then we really got interested into this about the meat attachment, that it's a strong, how strong a factor it was for actually being able to transit into this new, to the change in the diet. Well, I will just draw attention to that we have compiled some of the lessons learned in the Sausage Chain best practice sheets, which is available online. One of them was that from developing the products and from the food innovators, doing the food innovation, the minification, how you grind it, or how you, all kind of grinding, either of the dried insects or the fresh insects, had a high impact on the diet, on the sensory quality. So really the technological details about the minification is something which needs to be really to pay attention to. We also have compiled about what would be the approaches for developing insect-based food products, that you can take either novel products, say, well, here is a product which we can, which is where we make use of the special characteristics of the insect. We can also mimic products who make something which look like something that you are used to, like the minced, like a minced meat, but minced insects. Then the sensory quality is extremely important. Really not exposing consumers to something which are disappointing. So really being sure not to release anything that is of poor quality. And then the consumers need to know what to do with these insects. And I have some examples here. Here are from the recipes that we provided to the participants in Copenhagen, with the nice pictures of how could you serve this for your family. And then I have some examples here from the Portugal study, where the participants would take pictures of how they prepare their dish at home. And you can see moving from how we would like to eat and what's actually going on at home can be, there's quite a difference. And this is where we really need to understand the food culture, food practices, and the food skills, actually the cooking skills of the consumers. We have here some publications coming out being from the study, where there's more details on the scientific outcomes, and there are probably some more coming in the future. And then I would just like to acknowledge the great work, the great collaboration to work on the sausage chain project team in the work package on food. Also just notifying that everything I've reported here and has been approved by the ethical committee in Denmark, and also that we were funded by the EU through the sausage chain main grant and also an additional grant. So thank you.
Thank you very much, Nanna, for your